Ever feel like you spend more time planning than actually treating? You are not alone. Today, we're diving into how you can streamline your pediatric OT treatment planning so you can focus more on what matters, helping your kids make progress. Hello, my name is Kokeb McDonald, and welcome to our RITP podcast. Today, we're going to talk about how to streamline your treatment plans so that your kids can make progress. Many pediatric OTs report spending hours and hours each week prepping for sessions. Resources are scattered or make it harder to find the right activity quickly. Some of them also report overwhelm and burnout. And sometimes, even coming into a session, they already feel defeated and confused. So, without having a clear system or treatment plan, it can make your treatment sessions overwhelming for you and also confusing for your client. So, what can we do? So, in this podcast, I just wanted to talk about some of the things that you can do to help create some kind of solution for your treatment planning session. The first one is starting with a targeted screening. So if you're part of your RTP certification program, you have access to all these tools. But if not, having a screening material that can give you an understanding of your client and each day will help you. Meaning that if you're using, for instance, the RITP screening checklist, you can quickly look through it to see what you're working on and being able to put together a treatment plan that is effective for your client. So use the RITP screening checklist to quickly identify the top 1 to 2 reflex integration focused or sensory integration focused, functional based, developmental based goals that you are addressing for that session. Sometimes when you're trying to address multiple things at once, you end up not addressing anything at all. So avoid over screening sometimes because that can overwhelm you. And I've seen it and with other therapists as well. So try to keep it short or like 1 to 2 or maybe 3 things that you're going to address. Because for the most sessions, we only have about 30-minute session or 45-minute session. Even in that, a lot of time, you're going to spend most of the time transition the child, getting them warmed up to the session. So they might not be even ready to participate with you. So having 1 to 2 or like maximum of 3 things that you're going to target for that session will help you achieve a better goal for that day. And another one is applying the one thing approach. So we talk about that at OT, especially inside the RTP program. We talk about what is the one thing you can do that. By doing that, everything becomes unnecessary. I read this from a book called The One Thing. If you've not read that book, please do that. But it really applies in everything that you do. And you can also apply that in your session. So if I have a 30-minute session with a client, what is the one thing I can do that's going to give me this domino effect improvement in all the areas that I'm trying to target? So we break that down inside our program and train our therapists exactly what to look for. Of course, you're going to need to have a baseline, understand developmentally what the child is at. But just having that can help you know that, okay, this is the one thing I'm going to do for the session, because if I work on at least this baseline approach, that my client is going to improve. So have some kind of goal or direction for each of the client you're going to work with, and that can help you as well. Something that you can write on the progress note or like in the chart, just one thing that you're going to work on and whether or not that you are able to address that specific area. Another thing can be embedding some kind of repetition and carryover, especially with a case that has a lot of goals that needs to be worked on. You feel overwhelmed. You can feel like, as a therapist, I know I felt that too. I wanted to be able to address all these things and end up not addressing anything. But what I've seen worked a lot is making sure that we are incorporating the team that's working with that client in our session. How can you do that? Obviously, you're not going to do it directly when you're working with the client, but we can give home programs or classroom programs for the teachers that they can carry over. And that way that other areas or other goals that you trying to target are being addressed. So it's not only you working with that child. And to remember that you're not the only one in the team. You probably see the child once a week or maybe twice a week. So making sure like how can I give these home programs or school programs that the other teams can carry over, that'll be something that's helpful for you. So if you're part of our RITP program, of course, use the RITP app. We have created all these done for you programs that you can easily embed and share with the teams, share with the parents. It doesn't have to be an activity that is overwhelming for them. It's something that you've already worked on that they can carry over for you so you can go to the next goal that you're trying to address in your session. So you can use any of the done for you program that we have and share with the clients, parents or caregivers or educators that you're working with. So that will be involving the caretakers, involving the educators. And then if you have the opportunity to work with other service providers, let's say you're an OT and you're working, there's a PT involved or vision therapist or anybody else in the team that working with you, make sure that if possible, invite them to carry over these activities as part of a solution for them too. For instance, if you're working with speech therapists, I know a lot of speech therapists want ideas for OTs to give them what to do to help regulate their client because most of the time they work on a seated position and they're working on speech and they want some movement or activity to help the child regulate it. So this is your chance to share some of the activities that you've been working on with them in order to help the child improve. So that's one way that you can share the treatment plan that you have and appropriately share with the team who can be able to carry it out better for you. So that is something that you can do. Another thing that you can also do is finding out what your client is most interested in. So that really helps with treatment planning and a session because if I understand the client I'm working with and what they're interested in and what's most important to them, I can incorporate that activity inside my session and give the client itself homework that they can do. Let's say your client likes baseball, like my son likes baseball. So any of the goals that we're working on is I need to get my client or the client you're working with to understand that whatever your goal you're working on, you try to address the main interest that the child has. So most likely the client will be able to do a home program initiating that activity at home because another struggle for parent is to initiate these home activities and to convince the child to do this work. But if you are able to help the client or the child you're working with and make them be more internally motivated and for them to take the time to do the home program that for them to initiate. So that's something that you can incorporate. So in that way, you're not overwhelmed by all the areas that you need to address, but you can be able to spread it out with the team, with the client, the child itself. You can do it with the team, and that would be the parent and the educators that are involved right there with you. And also in your session, making sure that you have at least one or two things that you're really focusing on and not feeling like you have to address everything. And then understanding what is that one thing that you're going to work on that is really at the baseline level that can help you and almost give you this domino effect in your session. Before we wrap up, take a moment to hear a brief comment from one of our therapists who recently completed our certification program. If it sounds like a kind of professional development you're looking for, that is, if you're looking for a program that is more holistic, that teaches you how to not only the academic and the theory, but teaches you how to implement, problem solve, and also work in a community and continue to work your clinical skill and grow your business. In the meantime, make sure that you check out the link below to learn more about the RITP certification program. See you next time.
My name is Julie Mishkin. I'm a pediatric occupational therapist. I currently work in an inclusion model preschool in the Washington, D.C. area. Part of my role is consultative, where I go into classrooms to support teachers with different needs that might fall under the purview of occupational therapy. And part of my work is doing small pull-out groups in collaboration with our speech therapist to support those children with skill building that they can bring back to their classrooms. If there are occupational therapists out there that are wondering if the RITP program is right for them, they should ask themselves if they are noticing some obligatory movement patterns or some unusual movement patterns in their clients and wondering what the best way to approach supporting these areas would be. This is a program that is, once you go through it, once you understand it, it's pretty easy to implement. And as therapists, we're busy, we have a lot to do, and having something that you can just plug and play and implement in a very user friendly, easy way is really important.
So I hope this is helpful. If you have any questions or comment, make sure to leave a comment. Thank you so much for tuning in today, and I will see you next time. Bye.